I'm going to tell you about the scariest thing that has ever happened to me while being a nurse, and it happened at my old hospital that I worked at for a couple years. And I had a patient one day. She had cirrhosis of the liver, so she was terminal, and she passed away in just a really terrible way. I went home, got a few hours of sleep, went back to work, and I was doing my first morning patient rounds at 5:30 a.m. I had a patient at the end of the hall, and it just happened to be just across the way from the patient who had passed away the night before. And as I'm walking out of this patient's room after checking on him, I kind of glance over into her room, and it was completely empty, because we had cleaned out all of her belongings. But I saw my charge nurse standing at her window, and she was looking very intently out the window at something. And I'm like, what are you doing? She was in there. I could see her silhouette. So it was really dark, and the sun was just starting to come up enough for me to see the silhouette of her body. And I'm like, what are you doing in here? And she slowly like turns her body, and she looks at me and doesn't say anything. So I'm like, okay, weirdo, you're like starting to freak me out. Seriously, why are you in here? And I flipped the light switch on, and as soon as the lights came on, no one was there.
Creepiest things that have happened to me as a nurse, part 5. When I was an LPN, I worked at a nursing home at the beginning of my years, and we had this beloved resident that we called Jimmy, and he lived in 1A, and he would always go around and talk to us and say goodnight to us every single night. One day, Jimmy just beautifully died in his sleep. And then 3 days later, someone moved into his room and came out of his room the second and third night he was there and said, "Can you please tell Jimmy to get out of my room? He must be demented, and he keeps saying that this is his room, but this is my room, and can you please go in and talk to him?" Me and the other CNA were super freaked out, and we did not go in the room. Finally, Dawn, one of the other CNAs on another wing, was like, "I'll go in." No one was there.
Tell me a ghost story that sounds completely unbelievable but is entirely true.
So I work in healthcare, and I've always worked in healthcare. And when I was 18, I worked in a nursing home. And it was my first job right out of high school. And I loved it. It was fun. And, I enjoy healthcare. Anyway, I was working night shift. And I think anybody that works in healthcare and that works night shift, if you know, you know. This was my first time working a night shift. I usually worked the PM shift, or from 3 to 11. I can't remember what it is anymore, but 3 to 11. But the people that were supposed to come in on nights didn't come. So then I had to stay. So 3 o'clock in the morning, I was trying to finish up some of the duties. I was helping one of the residents with something, and I was taking some garbage from their room into the utility room. And as I'm walking into the utility room, I see out of the corner of my eye what I thought was the nurse walking into another resident's room across the hallway. And so I walk in the utility room, I drop my stuff off. It takes me 30 seconds to do. It's not that hard. So when I come out, I look up and I can see the call lights off. So the call light, if you don't know healthcare, they're outside the rooms and they let you know that somebody needs something. So I thought the call light was on when I went in the utility room. That's why I thought the nurse was going in there, and it was off when I came out. So then when I go down the hallway, I can see the nurse standing at the end of the hallway by the nurse's cart. So I go down and I ask her, what did this resident need? And the nurse kind of looks at me puzzled and says, "I don't know. You're the one that answered the light." And I said, "Nope, I didn't. Kind of figured you answered it when you walked in there." And she goes, "What are you talking about? I haven't even been down there this whole night. I'm still passing her meds or doing whatever she was doing up there." She goes, "I haven't been down there." And I'm like, "What are you talking about? I literally watched you walk in there." She goes, "I have not been down there. I've been at this cart since the shift started." And she could see the weird, puzzled look on my face, I guess. So then she was she got this shit grin on her face. And she goes, "You saw her, didn't you?" And I go, "Care to fill me in? Who was that?" She goes, "We have a ghost. We have a ghost in the nursing home. We think it was a nurse. And she used to answer call lights, or she is answering call lights. That's why we think she was a nurse. And people see her all the time on the night shift." And I always tell people that this story always freaks me out. I know I do paranormal stuff all the time, and I'm usually a skeptical person when it comes to that, because I think a lot of stuff can be explained. But I always tell people, I think the reason that that story sticks out so much is number one, it happened to me, so I know what I saw. And number two is that I know what I saw. I knew I saw a person walk in that room. There was no doubt in my mind. I didn't think I saw something. It wasn't a shadow. It wasn't a blurry thing. Like, I know I watched somebody walk into that room. Is always stuck with me and has always freaked me out.
Hey friends, welcome back to the channel. Thank you so much for clicking. Kindly subscribe to this channel. So in today's video, we are talking about the creepy horror stories which happens in hospitals. So as we all know that a hospital is the most a place where a lot of horror things happened. So a lot of people on TikTok came out to share their experiences, especially the nurses, the healthcare assistants, and also doctors were sharing the experiences in their nursing homes. So guys, I also want to add on like why is these things happening in the hospitals. So one thing I can say is that hospitals are places of intense emotions. They are where lives begin and end, where people experience profound moments of joy and sorrow. This emotional energy can create a unique atmosphere that some believe attracts paranormal activity. The dimly lit hallways, the quiet and the constant flow of people experiencing intense emotions all contribute to the eerie vibe. Many hospitals have a long story, sometimes spanning over a century. Over the years, they have seen countless patients, staff, and visitors. With such a rich history, it's no wonder that people believe some spirits might live there. These buildings have witnessed so much life in depth, and some say the energy of those who have passed remains in the hospital. Another thing that I can say, the idea of emotional residue is another reason hospitals might feel creepy. This theory suggests that strong emotions leave an impact on the environment. Hospitals see a lot of pain, suffering, and sometimes trauma. This emotional residue might create unsettling atmosphere, leading people to feel like they are not alone, even when they are alone. Another thing that I want to talk about is the power of suggestion. When people hear stories about haunted hospitals, their minds are primed to notice anything out of the ordinary. A freaking light, an unexpected sound, or a shadow in the corner of their eye can be interpreted as a paranormal activity. This highlight sense of awareness can make normal hospital occurrences seem creepy. Another thing that I want to talk about is the night shifts in the hospital can be particularly um creepy also. The usual bustling hallways are empty and the hospital is much quieter. This silence can amplify any unusual sounds, making them seem more significant. Nurses and doctors working late often report strange occurrences, possibly because their senses are highlighted by the quiet and isolation. Another thing that I want to talk about is working in a hospital can be incredibly stressful. The long hours, the emotional toll, the responsibility can all contribute to high rated anxiety and stress. So these psychologists state they might make people more susceptible to notice and interpreting creepy phenomena. When you're already on a edge, it's easy to let your imagination run the world. So another thing is hospitals are the perfect bleeding ground for creepy stories due to their emotional intensity, historical significance, and the psychological state of those who spend time there. Whether you believe in ghosts or not, there is no denying that hospitals can be incredibly illa places. Have you ever experienced something strange in a hospital? Let me know in the comment section below. And the other thing that I want to tell you is I think at one time I also experienced something creepy where I was working in the night shift with my fellow nurses. Okay. So we were like sleeping. Okay. So while I was sleeping, I felt like there's someone again in our room. So when I woke up, I saw someone standing like 30 seconds, 30 seconds. I saw someone standing on the corner just looking at us. So when I just tried to do my hands with to do my eyes with my hands to make sure that I'm looking straight, I just saw someone still standing. But again, this person, I wasn't even seeing him on the face, or I didn't know if it was her. After some time, after looking and looking, this is when I saw that there's no one there. So I don't know if it was just imagination, but actually I saw someone. And these things, like, they kept on happening in the hospital where I was working, where a lot of people were complaining that they are seeing ghosts. There are ghosts in that hospitals. These stories which just happens in hospitals. So yeah, like a lot of creepy things, because in hospitals, this is where life starts. Someone is born in the hospital and they come to die in the hospital. So it has a lot of emotions, a lot of imagination, and a lot of pain there. So that's what I think, guys. Thank you for watching this video. I really appreciate. Let's leave our comment like in the comment section so that we discuss.